When patients come in for surgery, part of the evaluation is to see if you're a good candidate for surgery and whether or not it's a good idea to move forward. And sometimes I have to turn patients down for surgery. And there are four main categories as why I turn patients down for surgery. One could be aging and timing. They're not the right age, or the timing isn't good. There can be another reason could be expectation mismatches. Another reason to turn patients down for surgery is compliance concerns. And then the fourth reason to turn patients down for surgery are medical safety factors. And we'll go into each one of these categories in a little bit more detail now. So, as far as medical safety factors are concerned, there are lots of medical reasons why we might turn somebody down for surgery. For example, if they have uncontrolled health conditions like diabetes or high blood pressure, it's not safe to proceed with surgery. Another reason to turn patients down for surgery can just be due to their weight. If their BMI is over 30, we know the complication rates really go high when your BMI is too high. So it may be no to surgery now, but it's more not yet. If you lose some weight, you may become a candidate for surgery. Continued smoking is a no-go for surgery. And some patients are on medications that can't be safely stopped. If they're on blood thinners or they're on some immunosuppressive drugs, everybody's weighed on a case-to-case basis, but those are things that may get you a no for surgery. And then if you've got some significant prior surgical complications, that may also rule you out for surgery. So those are some of the medical safety factors that can prevent you from having surgery. There are psychological reasons why we may turn you down for surgery as well, and that can be something like patients with unrealistic expectations. If they've got an obsessive fixation with a body part or a particular problem, that can be something that's a sign of body dysmorphic disorder syndrome. That would be a reason to turn a patient down for surgery. Another psychological reason would be as if you're doing it for somebody else and you're not really doing it for you. And then sometimes it's bad timing emotionally. Transitional periods like separation and divorce or job changes just may not be the right timing for surgery for you. So those are some of the psychological impediments to surgery. One of the other categories where I might say no to surgery for somebody is really behavioral or compliance concerns. And if a patient tells me beforehand that they're not going to be able to follow the postoperative instructions, that's going to be a problem because your results depend upon not only the surgical procedure, but your involvement with your recovery. And if you're not able or willing to work with me to help you get the best outcome, then that's not going to be a good match and you're increasing your risk for a bad outcome. And if I get the sense of that, then it may not be a good time for surgery. And sometimes it's more of a practical thing where a lot of women, after having had kids, want to do a mommy makeover or tummy tuck, but they have little kids at home that they have to take care of and they can't take several weeks off of being a parent to take care of their children. They need to be a patient and recover. So sometimes it's bad timing, and that's not necessarily a bad thing, but if somebody says, I have the time, but I just won't commit to it, that can be a problem. Another red flag for somebody really potentially having problems following directions, honestly, is if somebody is really mean or rude to all the people in the office, the staff, not necessarily me as the surgeon, but if somebody is not really fitting in well emotionally with the rest of the practice, that may be a sign that this isn't a good fit for both of us. So those are some of the kind of behavioral reasons why we might turn somebody down for surgery. And the fourth and final category as to why we may turn somebody down for surgery can be related to age and timing. So for example, if somebody wants a breast augmentation with the silicone implant, by law, you have to be 22 years old or older to get a silicone implant. You can get a saline implant at the age of 18, but you can't get a silicone implant until you're 22, federal law. So we might turn somebody down for surgery for that reason. Obviously, it's not a good idea to operate on somebody if they're pregnant, so that's another kind of timing issue. And then sometimes, depending upon the surgery that we're talking about, your particular anatomy, if you're planning on getting pregnant in the next year, it may be better to hold off a particular surgical procedure till after the pregnancy. So some of that some of that is the aging and timing issues that patients may find that delays or holds off surgery for them. So kind of the fourth category talked about is aging and timing. Sometimes you may not be the right age for a particular surgery. Specifically for breast augmentation, a woman who's 18 years old can get a saline implant, but you have to be 22 years old or older to get a silicone implant. So if you're 19 years old and you want breast augmentation and you want a silicone implant, it may not be time. You may have to, you do have to wait because that's an FDA regulation. Another timing issue is if you're actively pregnant. Pause. And the fourth category of reasons why we sometimes say no for surgery is related to age and timing. And there's a couple of specific things there. So if you're pregnant, it's obviously not a good time to have surgery, and we're going to have to delay that surgery. If you're planning to get pregnant, depending upon the surgery that we're talking about, you may be better off actually waiting till after the pregnancy before going ahead with surgery. And that may be for something like a tummy tuck procedure or a breast lift procedure. If you're about to get pregnant with your third child and you're planning on breastfeeding, it's probably best to wait until after you have that third child before we move on with surgery. And then the other age and timing thing has to do with breast augmentation specifically, because federal law allows women who are 18 years old to get a saline implant, but you have to be 22 years old or older to get a silicone implant. So if a 19-year-old woman wants a silicone implant, we just can't do it by law. We have to wait a couple of years, or she can choose to have a saline implant. So those are some of the aging and timing issues that patients may run into with surgery. So for some patients, getting a no for surgery is sometimes no, not now, no, not yet, let's hold off. And there's really all these different factors that we have to consider before moving forward with surgery. And so it's not uncommon to get a no or a not yet when we're talking about timing and planning for surgery. And don't be discouraged if your surgeon says, hey, we need to take these things into consideration. If you've got uncontrolled diabetes, we can work on controlling your diabetes before we move forward with surgery. And that's also good for you to get your diabetes under control. So things like that, a lot of times we can affect that and turn that no into a yes, and you just need to work with your surgeon and your team to get you there. So that's kind of a wrap up of, no, don't like that. So to wrap things up, the four categories that we talked about are medical safety factors, compliance concerns, psychological, and age and timing. Those are reasons to get a no for surgery, but frequently that's more of a not yet, or maybe we need to work on some things before we can get to a yes. And you can work with your primary care doctor, with your surgeon, to control some of those factors. So if it's an issue with your BMI being too high, or your diabetes isn't controlled, or we need to wait until your kind of job settles down before it's time for surgery, we can work on all that stuff, take care of all those things, and get to a yes.